In the stone halls of 19th-century French asylums, doctors strapped down screaming patients and began drilling holes directly into their skulls. They weren't trying to cure disease or remove tumors. They believed demons were trapped inside these people's heads, causing madness and seizures. The only solution was to drill a hole and let the evil spirits escape. What followed was a nightmare of blood, infection, and death that lasted for decades. This is the horrifying story of medical trepanation and the patients who died for a cure that was never real. Trepanation is one of humanity's oldest surgical procedures. For thousands of years, people have been drilling holes in skulls, and archaeologists have found evidence of this practice dating back to prehistoric times. But by the 1800s, this ancient ritual had evolved into something far more sinister. The procedure itself was simple but brutal. Doctors would use specialized tools to drill or scrape a hole directly through the skull bone, exposing the protective membrane around the brain called the dura mater. The opening could be as small as a coin or as large as a person's palm, depending on what the doctor believed needed to escape. In 19th-century France, trepanation wasn't performed to treat physical injuries or remove brain tumors. Instead, doctors were convinced that mental illness, epilepsy, and seizures were caused by supernatural forces trapped inside the skull. They believed that drilling holes would provide an escape route for these demons, instantly curing the patient's psychological problems. This wasn't some fringe medical theory practiced by a few eccentric doctors. Leading physicians across France endorsed trepanation as a legitimate treatment for mental disorders. Medical textbooks described the procedure in detail, and hospital administrators allocated resources specifically for skull drilling operations. The patients subjected to these procedures were among society's most vulnerable. They were people suffering from epilepsy, depression, schizophrenia, and other mental health conditions that were poorly understood at the time. Many had been abandoned by their families and confined to overcrowded asylums where they had no voice in their own treatment. To understand how respected doctors could justify drilling holes in people's skulls, you need to understand the prevailing medical theories of the time. Despite advances in anatomy and physiology, many physicians still believed that mental illness had supernatural causes. Epileptic seizures were particularly associated with demonic possession. When patients experienced convulsions, spoke incoherently, or exhibited unusual behavior, doctors saw this as evidence that evil spirits had invaded their bodies. The seizures themselves were viewed as battles between the patient's soul and the possessing demons. This belief wasn't limited to uneducated peasants or religious extremists. Paul Broca, one of France's most respected neurologists and the discoverer of the brain region responsible for speech, wrote extensively about prehistoric trepanations that were clearly designed to release trapped spirits. Even he seemed to accept that supernatural explanations for mental illness had some validity. The demon theory provided a simple explanation for complex psychological phenomena that doctors couldn't otherwise understand. If a patient heard voices, became violent, or lost touch with reality, it was because evil spirits were influencing their thoughts and behavior. The logical solution was to provide those spirits with an exit route. Medical journals of the time described detailed classifications of different types of possessing spirits and the specific symptoms they caused. Some demons supposedly caused depression and melancholy, while others triggered violent outbursts or sexual dysfunction. Each type of possession required slightly different trepanation techniques to ensure the spirits could escape properly. The setting for most trepanation procedures was France's network of psychiatric asylums. These institutions had undergone significant reforms in the early 1800s under the influence of Philippe Pinel, a physician who advocated for more humane treatment of mental patients. Pinel had literally freed patients from chains at the Bicêtre and Salpêtrière hospitals, earning him recognition as a pioneer of compassionate psychiatry. But even as reformers worked to improve living conditions in asylums, they continued to endorse brutal surgical treatments like trepanation. The contradiction seems impossible to modern minds, but 19th-century doctors genuinely believed they were helping their patients by drilling holes in their skulls. La Salpêtrière one of Paris's most famous psychiatric hospitals, became a center for trepanation research and practice. The massive institution housed thousands of female patients diagnosed with hysteria, epilepsy, and various forms of madness. Its surgical wings were specifically designed for procedures like skull drilling, complete with restraining tables and specialized drilling equipment. If you're finding this as disturbing as we are, make sure to subscribe because what we're about to reveal about these procedures will shock you even more. Charenton, another major Parisian asylum, also conducted regular trepanation surgeries. The hospital's records show that dozens of patients underwent skull drilling procedures each year, with many operations performed as public demonstrations for medical students and visiting physicians. These institutions operated with virtually no oversight or accountability. Patients had no legal rights and couldn't refuse treatment or seek second opinions. Asylum directors had complete authority over their charges and could subject them to any procedure they deemed medically necessary. The architecture of these asylums reflected their dual role as hospitals and prisons. Thick walls, barred windows, and locked doors prevented patients from escaping, while surgical theaters allowed doctors to perform operations in front of audiences. The combination of medical authority and physical control created conditions where even the most extreme procedures could be justified as therapeutic interventions. The actual trepanation procedures were nightmarish ordeals that often lasted for hours. Patients were typically strapped down to prevent movement during the surgery, though some were simply held down by multiple attendants. Anesthesia was rarely used, partly because effective anesthetics weren't widely available, and partly because doctors believed patients needed to remain conscious so the demons could escape properly. The drilling process began with doctors marking the intended hole location on the patient's scalp. They would then use sharp knives to cut through the skin and muscle, exposing the skull bone underneath. Blood would immediately begin flowing from the incision, often obscuring the doctor's view of the surgical site. Next came the actual drilling. Doctors used various tools depending on their preferences and the equipment available. Some favored traditional drill bits that required manual rotation, while others preferred scraping tools that gradually wore away the bone. The process was slow and agonizing, with the sound of grinding bone audible throughout the surgical theater. As the drill broke through the skull bone, patients would experience excruciating pain that no amount of restraint could completely suppress. Many would scream, convulse, or lose consciousness from the trauma. Doctors interpreted these reactions as evidence that the demons were fighting to remain inside the skull. Once the hole was complete, doctors would carefully examine the exposed brain tissue for signs of abnormality. They looked for discoloration, swelling, or unusual textures that might indicate the presence of evil spirits. Sometimes they would probe the brain directly with instruments, causing additional damage to delicate neural tissue. The final step was to dress the wound and wait for the patient to recover. In successful cases, the hole would eventually heal over with scar tissue, leaving the patient permanently marked by their ordeal. But many patients never recovered at all. The mortality rate for trepanation procedures was staggering, though exact statistics are difficult to determine because asylum records from this period are incomplete or have been lost. What documentation exists suggests that at least half of all patients who underwent skull drilling died within days or weeks of the surgery. Infection was the most common cause of death. The drilling process created an open wound that extended directly into the brain cavity, providing bacteria with easy access to the central nervous system. Without modern antibiotics or sterile surgical techniques, these infections were almost always fatal. Even patients who survived the immediate surgery often suffered severe complications. Brain damage from the drilling process could cause paralysis, speech problems, memory loss, or personality changes. Some patients developed chronic seizures that were worse than their original symptoms. Uncontrolled bleeding was another major risk. The scalp and skull are richly supplied with blood vessels, and cutting through them without proper surgical technique could cause massive hemorrhaging. Patients who bled too much during surgery would go into shock and die before the procedure could be completed. The psychological trauma of undergoing trepanation was severe even for patients who survived physically intact. Being forcibly restrained and having holes drilled in their skulls while conscious left many patients with severe post-traumatic stress that compounded their original mental health problems. Perhaps most tragically, there's no evidence that trepanation ever actually helped anyone. Patients who showed improvement after surgery were likely recovering from their underlying conditions naturally, not because demons had been released from their skulls. The procedure was not only brutal and dangerous, but also completely ineffective. One of the most disturbing aspects of 19th century trepanation was how these procedures were often turned into public spectacles. Medical schools would invite students to observe skull drilling operations as part of their education, while distinguished physicians from other institutions would attend as honored guests. These demonstrations served multiple purposes beyond medical education. They showcased the skills and techniques of leading surgeons, promoted new surgical instruments and methods, and reinforced the authority of the medical profession. But they also turned human suffering into entertainment for educated audiences. Detailed accounts of these surgical demonstrations reveal how doctors would narrate their procedures like theatrical performances. They would explain their reasoning for each cut and drill stroke, point out anatomical features of interest, and speculate about the types of demons they expected to find inside the patient's skull. The audiences for these demonstrations were not passive observers. They would ask questions, offer suggestions, and debate the finer points of trepanation technique. Some would take detailed notes or make sketches of the procedures, creating permanent records of the patient's suffering. Patients undergoing trepanation during these demonstrations faced the additional humiliation of having their most vulnerable moments witnessed by dozens of strangers. Their screams, convulsions, and pleas for mercy became part of the educational experience for future doctors. French trepanation techniques didn't remain confined to France. Medical journals published detailed descriptions of procedures and outcomes, spreading these methods to other countries across Europe and beyond. British, German, and American doctors began adopting French approaches to skull drilling for mental illness. International medical conferences featured presentations on trepanation research, with French physicians sharing their latest findings with colleagues from around the world. These gatherings helped standardize techniques and promote the procedure as a legitimate medical treatment. The export of French trepanation methods had devastating consequences for vulnerable patients in other countries. Asylums in Britain began performing regular skull drilling operations, while German psychiatric hospitals developed their own variations on French techniques. American doctors, eager to adopt the latest European medical advances, brought trepanation to hospitals across the United States. This international spread of trepanation created a global network of institutions where mentally ill patients were subjected to brutal skull drilling procedures. The practice persisted in some countries well into the 20th century, long after it had been abandoned in France. The medical establishment played a crucial role in legitimizing and perpetuating trepanation for mental illness. Professional medical societies endorsed the practice, medical journals published research supporting its use, and leading physicians advocated for its adoption in their hospitals. Medical textbooks of the period included detailed chapters on trepanation techniques, complete with anatomical diagrams and step-by-step instructions. These authoritative sources gave skull drilling the same scientific credibility as other accepted medical procedures. Professional medical societies held regular conferences where trepanation research was presented alongside other advances in surgical technique. Physicians who pioneered new drilling methods received recognition and honors from their peers, encouraging further innovation in skull-based treatments for mental illness. The medical licensing system also contributed to the problem by requiring doctors to demonstrate familiarity with current treatment methods, including trepanation. Physicians who questioned the effectiveness or ethics of skull drilling risked being seen as behind the times or insufficiently committed to helping their patients. The eventual abandonment of trepanation for mental illness didn't happen overnight. It required a fundamental shift in how doctors understood the relationship between the brain and psychological symptoms. This change began in the mid-19th century as advances in neurology and psychiatry provided better explanations for mental illness. Jean-Étienne Dominique Esquirol, a student of Philippe Pinel, was among the first prominent physicians to question the demon theory of madness. He argued that mental illness had natural rather than supernatural causes and could be treated through psychological and medical interventions rather than surgical ones. Guillaume Ferrus, another influential French psychiatrist, advocated for therapeutic approaches based on understanding patients' individual circumstances and psychological needs. He demonstrated that many mental health problems could be improved through compassionate care, structured activities, and proper nutrition. These reformers faced significant resistance from the medical establishment, which had invested heavily in trepanation research and infrastructure. Many hospitals had spent considerable resources on surgical equipment and training, making them reluctant to abandon procedures they had practiced for decades. The transition away from trepanation was also slowed by the lack of effective alternative treatments. Without modern psychiatric medications or psychotherapy techniques, doctors felt pressured to offer some form of intervention, even if it was ultimately harmful. As evidence mounted that trepanation was ineffective and dangerous, the medical establishment began efforts to minimize and hide the extent of the practice. Hospital records were altered or destroyed, research papers were quietly withdrawn from circulation, and physicians who had championed skull drilling tried to distance themselves from their earlier work. Official statistics about trepanation mortality rates were manipulated to make the procedure appear safer than it actually was. Deaths were attributed to patients' underlying mental illnesses rather than surgical complications, while successful outcomes were exaggerated or fabricated entirely. Medical journals stopped publishing new research on trepanation and began rejecting papers that criticized the practice too harshly. This created an artificial scientific consensus that skull drilling had been a reasonable treatment given the knowledge available at the time. The conspiracy of silence around trepanation was remarkably effective. Within a generation, most medical professionals had forgotten about the widespread use of skull drilling for mental illness, allowing the medical establishment to avoid accountability for decades of harmful practices. The legacy of 19th century trepanation extends far beyond the individual patients who suffered and died during these procedures. The practice represents a dark chapter in medical history that demonstrates how professional authority and scientific credibility can be used to justify horrific abuses. The willingness of respected physicians to drill holes in patients' skulls based on supernatural theories reveals how medical professionals can become trapped by their own assumptions and biases. Even intelligent, well-educated doctors can convince themselves that harmful practices are beneficial if those practices are supported by professional consensus. The trepanation era also highlights the vulnerability of psychiatric patients who continue to face discrimination and abuse in modern healthcare systems. The same factors that enabled 19th century skull drilling continue to put mentally ill patients at risk today. Perhaps most importantly, the history of trepanation serves as a warning about the dangers of medical overconfidence. When doctors claim certainty about treatments that lack solid scientific evidence, patients suffer the consequences of professional arrogance and institutional groupthink. While doctors no longer drill holes in skulls to release demons, the fundamental problems that enabled 19th century trepanation persist in modern medicine. Vulnerable patient populations continue to be subjected to experimental treatments with limited evidence of effectiveness. Psychiatric patients today face many of the same risks their 19th century counterparts experienced. They may be prescribed powerful medications with serious side effects, subjected to invasive procedures, or confined against their will in institutional settings with limited oversight. The medical establishment's tendency to close ranks and resist criticism also continues to protect harmful practices. Professional licensing boards, medical journals, and hospital administrators often prioritize institutional reputation over patient safety, making it difficult to expose and correct dangerous treatment methods. The last recorded case of trepanation for demon removal in France occurred in 1889, but the practice didn't disappear entirely. In remote regions around the world, traditional healers still drill holes in skulls to treat mental illness and seizures. Even more disturbing, Some modern alternative medicine practitioners have revived trepanation as a treatment for depression and anxiety, claiming it can improve brain function by increasing blood flow. The demons may have changed names, but the drills are still spinning, and vulnerable patients are still paying the price for medical delusions that refuse to die.